is intimate and it's a privilege, and it's nice because it establishes a deep relationship with that patient for not only care of them in that pregnancy, but subsequent pregnancies and any health care they need afterwards.
It's a great privilege to be part of that. It's a very intimate event, and to be trusted enough to be a part of that is a very special thing.
I think it's just sort of important to focus on the goal of this, or the goal would have been to have a healthy mom and a healthy baby, and if you keep that in perspective, I think it always makes for a better experience.
Hand that baby over to the mom and see the smile on the dad's face is really pretty special. We've created this group of excellent providers so that every patient is going to have extraordinarily high quality care with full knowledge of what's going on with their particular case, with their particular problems, if there are any. We're really going to be able to provide an absolutely stellar experience, I think, for all of our patients.
The way our practice works, they get to meet everybody, so the person coming into the delivery room is a face that they've seen before. It's not somebody that's, you know, kind of unknown to them, and someone who knows their case well.
I think the group practice benefits the patient most because it allows us as a whole to practice evidence-based medicine and do the best thing for our patients, and still allow us to you know, build a relationship with a patient. It's not a large group where there's 30 providers in a group and you never meet the same person twice. It's small but not too small. It's big but not too big. It's kind of the mama bear of group practices, and it really allows us to take care of the patients in the best way.
I was a first time I delivered a baby, I remember I was in medical school. It was 4 o'clock in the morning, and at that point I was not used to staying up at, you know, well, maybe not in those circumstances, that late. And I remember fighting back tears. It was just a very emotional experience. And I've gotten a little more stoic, and I'm in better control of my emotions these days when it comes to delivering, but it's still, I mean, every time it's an exciting emotional experience. So.
I distinctly remember my first delivery because I was awash in amniotic fluid and I didn't even care. I was so excited to be there. A patient had come in and was delivering very quickly, and we didn't have time to do the usual preparations, so just a medical student threw me in there and away I went to go catch that baby, and it was a very cool moment, and one of the sentinel things that led me into obstetrics is being there with that moment and experience, and how happy the parents were and how great a moment was.
The dream of being a physician was very strong for a long time, and I had my nose in a book forever, and finally we got to start seeing patients and doing stuff. So I was able to see a couple of deliveries as a new third-year student, and then got to deliver my first baby, and I was so excited, and I've delivered about 5,000 babies so far, and I still remember that one very well.
The facilities here, state of the art, and you can really get a sense whether it's the group practice or extending our practice down to Freeport or the facilities here at the hospital. Everything is definitely geared at the best and most positive patient experience that we can provide. And that's convenience for the family, comfort while you're in your room, comfort while you're recovering. It's really aimed at the convenience and experience of the patient. So
I think we can't forget the nurses and staff. It's a beautiful facility, and yet what patients are going to remember and the experience they have here is the care provided is going to be outstanding, and they can expect that. Our first goal is to, I tell patients, our first goal is to get mom and baby through this safely, and then secondly, to make sure they have an excellent experience. So that's our goal.